Let's find out more about that. Let's bring a couple of doctors into the mix. Board-certified cardiologist, Dr. Luiza Petre, and senior scholar at Johns Hopkins Center for Health and Security, Dr. Amesh Adalja, both join us now. Good to see both of you this morning. Good morning. Luiza, let me start with you, first of all, and any concern that we might have or that people might have floating out there about this so-called twin-demic. Is it a real possibility this year?
Definitely, we're sitting at the crossroads with the two viruses hitting the season at this time. And the most dreaded scenario is that the two viruses could bundle up, what we call a twin-demic. And the danger is that they both tap into our immunity. And if they affect the same person in the same time, and unfortunately we have seen cases emerging worldwide, also in the United States, the mortality could skyrocket because the person would be way too sick to be able to handle both viruses.
Yeah, and that's my quick follow-up question for you, doctor, is if you get them both at the same time, is it essentially much more dangerous to have them both as opposed to fighting one off versus the other?
That's correct. The effects could be compounding. This is not additive. 1 + 1 make 2. They could make 6 in this situation. That's what we worry most about.
People in the county that don't.
All right, Dr. Adalja, let me bring you in on this now. How would we know at some point if we have symptoms? Is there a way to get tested for both at the same time? Do we go through each individual test? How does that process play out as we get into the fall season?
The symptoms of influenza and COVID-19 are completely overlapping, and you wouldn't be able to distinguish them based on clinical examination. You need to do some sort of testing. And right now, there are tests that are separate, a flu test and a coronavirus test, but there are companies now that are making dual tests. And it will be important to rule out one or the other because they have two different treatment pathways. You may get steroids or remdesivir with COVID-19. With influenza, steroids are harmful, and you will get something like Tamiflu. So it's going to be really crucial to be able to distinguish these two as we move into flu season.
All right, Dr. Adalja, let me stay with you for just a second then. If I know that a lot of doctors are saying, look, just make sure you get the flu vaccine this year, perhaps more important than it has been in past years. If you get that, would the flu vaccine give you any preventative measures against coronavirus, or are they just completely separate and they would not overlap in that manner?
We wouldn't expect that the flu vaccine would give you any protection against COVID-19. Remember, these are two distinct viral families. Even though they have similar symptoms and they spread the same way, they have totally different genetics. So the flu vaccine is important to get in its own right because we want to have room in the hospital to take care of patients with COVID-19 because flu is going to compete for the same resources in hospitals, ICU beds, personal protective equipment with COVID-19. So we want to make sure we have capacity to keep flu as low as possible.
All right, Dr. Petre, let's talk about that capacity and preparing for this in the medical community. How do you prepare for what could be an influx of just, even if they're not overlapping, of just flu patients in addition to the COVID patients that we already have right now? And is there any concern in the medical community that if essentially we have a flu outbreak, even the flu outbreak we might have in other years, that it might be looked at perhaps as a second coming of the coronavirus?
Number one preventive measures remains the social distancing and wearing masks. That will definitely help both viruses. Second, we already have increased the number of vaccine production, so we make it available for more Americans this year. If last year we had only 50% of population who need a vaccine receive it, we definitely urge the population this year. And many states actually created the flu vaccine centers outdoors with social distancing. If people are concerned going in indoor or to their medical doctor for a flu vaccine, at least they have the option to get it somewhere outside.
Dr. Adalja, I want to come back to you for the final question. And, there are some people who have said, look, we've spent the last 6 months perhaps keeping ourselves cleaner than we ever had before. We're all used to washing our hands for 20 seconds now, wearing masks in public, social distancing. Might that lead to less people getting the flu this year?
It definitely will. And if you look at the Southern Hemisphere flu data, they've had a dramatic reduction in influenza. So it is true that the same social distancing, the same personal hygiene factors that are keeping COVID-19 at bay in some parts of the country are going to keep influenza at bay. So we want to continue to do this, and hopefully we'll get an added benefit in our flu season will not be as severe if people get vaccinated and continue to follow these common sense recommendations to keep COVID and flu both as low as possible.
Well, doctors, we appreciate both of your times this morning. As we have previous times we've had a chance to chat with you. We'll talk with you again soon. Thanks very much. Stay safe, stay healthy.